Good morning, everyone. Today, the topic of our discussion is with all this COVID going around. I don't want to discuss COVID further because I think you have been given enough information about it. So, today we are going to discuss about pregnancy, a normal pregnancy, and what are the requirements for a normal pregnancy. You need to have a healthy diet, and there are few myths which are associated with diet and with exercise also. कोई आपको बोलेगा आप ऐसे नहीं झुको, आप ये मत उठाओ, ये मत करो, ये वाली एक्सरसाइज ठीक नहीं है, you should not eat this, you should avoid this. So let's just go into detail what exactly is the requirement in pregnancy. So I would say in pregnancy the requirements are you have to follow a normal diet which everyone is following. It's not like a last के month में आपको अपनी diet में fat ज़्यादा करना है, which usually you must have heard from your elders also कि घी ज़्यादा खाना शुरू कर दो, it helps in delivery. It's nothing like that. You have to understand a logic behind it कि क्यों घी बोला जाता था कि घी ज़्यादा खिलाओ. Because उस time पे जो females थी, they were undernourished, they were not given proper meals at that time, and they were not given the supplements which are required for them. So this was the only period जिसके अंदर उनको घी दूध सब कुछ दिया जाता था. So prepare them for a delivery. But for you, if you are going with your normal pregnancy guidelines and you're following your doctor properly, you have been given proper supplements. You have the health supplements in the form of folic acid, iron ले रहे हैं आप, calcium ले रहे हैं, plus good protein diet. So in the end, it's the protein diet plus a healthy diet is important. So for a female, what is the requirement of a pregnant female? Requirement of a protein is 75 gram during pregnancy, which is usually, if I say 60 gram पे अगर आप ले तो 1 gram per day हो जाती है normal में, but in pregnancy it's up to 75 gram per day. Which you can get from a lot of things around you. You can get it if you're a non-vegetarian, then you have an option of eggs, then you have fish, then you have an option of chicken also. But in a vegetarian diet, you can have cooked sprouts, you can have pulses, and you can have these salads जो आप बना के रख सकते हो अपने साथ में with lots of vegetables and fruits डाल के. You can have with ये sprouts के साथ में salads बना सकते हो. Or you can have just boiled salads of ये काबुली चना and चना या राजमा का. So anything which gives you a protein diet plus doesn't is not filled with so much gravy. क्योंकि in the end क्या है कि the digestion process in a female during pregnancy is slow down because pregnancy is a relaxing state. So everything gets slowed down. So if you start taking that spicy food, तो वो आपको नहीं digest होगा. Then you'll have gastritis. Then you have other issues. So एक ऐसी वाली पनीर मसाला करी खाने से अच्छा आई वुड से कि अगर आप पनीर को ऐसा खा लेंगे ना 200-250 ग्राम, just saute it, just have it. That's the best way to have it. There are other ways also which you can have cheese also. Cheese आप salads में डाल के बीच-बीच में खा लो. So these are few things you have to keep in mind. Why we are doing this topic? अभी summers है. Summers में you have to understand your water requirement, which is one thing I've seen with many of my patients is summer के time पे you end up eating या तो आप बाहर से कुछ खा लेते हैं and that just आपके सारा स्टमक को सब कुछ खराब कर देता है and then you end up having loose motions or vomiting or gastritis. तो उससे क्या होता है कि आपका जो वो जब से वो imbalance होता है it lands up not only you dehydrated, it eventually decreases the water content around the baby also जो उसको चाहिए. So you have to be very cautious about what you're eating from outside because you have to understand your stomach is not going to take it as easily as it was taking it when you were not pregnant. So उसको थोड़ा सा बैलेंस आउट करना है. प्लस योर लिक्विड रिक्वायरमेंट इज मोर देन अस. आप सोचो आपका लिक्विड रिक्वायरमेंट जो है द पेशेंट्स कम टू यू एंड दे टेल यू मेरे को स्वेलिंग हो रही है लेग्स में हैंड्स में. You have to understand the blood volume is also increased. That is also one water requirement which your body needs to fulfill. It's not only water जो सिर्फ बच्चे के आसपास वाला है या सब कुछ है. It's a complete physiological change that takes place in a female. So the water requirements are going to be more than anyone around her who is not pregnant or lactating. So what I'm trying to say is कि आपका पानी का ऐसा होना चाहिए कि you should have a count on it. it's not like only water लेना है आपको. You can have coconut water. In fact, you should have lemon water. और इस season में, because with some salt, black salt also, it's wonderful because you are not losing water only by sweating. You are losing electrolytes also. And the common problem or the common mistake I find with patients is they keep on drinking water. They don't take the electrolytes with it, which are also required. So by evening, the usual complaint I've seen with my patients is मेरे को टांगों में बहुत दर्द होती है, मुझे बहुत घबराहट हो जाती है, I'm not able to carry further after evening. So it's because this is a sign of dehydration. It's not like कि आपके अंदर कुछ ऐसा change है. If you keep your liquids replenished, जैसे अगर आप every hour में you're taking some form of liquids, then obviously you are replenishing yourself enough. And liquids में अभी तो गर्मियों में you can have छाछ also, milk shakes ले सकते हो. And milkshakes में भी you have to just keep in count that if you're taking a milkshake and if you at least need to take a glass of milk. So अगर वो glass of milk में you're adding this ice also and the fruits also, वो 1.5 glass हो जाएगा. So what you can do in a better situation is कि if you want to make a milkshake, उसको थोड़ी देर के लिए that milk को keep it in a freezer. थोड़ी देर के लिए एक कार के लिए just let it chill, वो थोड़ा सा crystals उसमें भी बन जाएगा and just then churn it with the fruits. तो वो क्वांटिटी आपसे लेनी आसान हो जाएगी एंड यू आर गेटिंग मिल्क, यू नॉट गेटिंग अ डिल्यूटेड फॉर्म ऑफ मिल्क विच यूजुअली पेशेंट्स विल से कि मैं तो 2 बार मिल्क, मैं तो ले रही हूँ 2 बार शेक्स ले रही हूँ, फिर क्यों मेरे को ऐसा है कि मेरे में आई एम नॉट टेकिंग इनफ मिल्क और दैट्स द रीजन. सो ये फ्यू थिंग्स हैं विच वी नीड टू कीप इन माइंड. प्लस अब खाने में भी आपको यू हैव टू कट डाउन ऑन कैफीन ऑल्सो. Is it that a pregnant woman should not bend too much? Yeah, this is also one thing you have to realize that it's not only bending which is the problem. The problem is this कि your center of gravity changes. जैसे जैसे आप pregnant होते हैं, आपका अगर bump आगे जा रहा है तो आपका center of gravity change हो गया. So you are very prone to fall also. So rather than bending के चक्कर में you can actually fall off. और अगर आप गिर जाओगे तो आप it will become more harmful for it. So either you have someone जो आपको उठाकर दे दे कुछ चीज if you want to मतलब कुछ गिर गया है, you really want to bend and get that thing, और otherwise आप उसके बिल्कुल साइड पर बैठे. This is what I tell my patients, उसके साथ बैठ जाओ and then just pick it up rather than bending it. So obviously I would not recommend bending at any point. Bending is good. And plus abhi what foods are recommended during first few weeks of pregnancy. So foods which are recommended for first few weeks are any time of the period. The food which are required should be nutritious enough, should not be oily, should not be spicy, and there are few fruits which we want to avoid. One of them is papaya, and there are few studies or few people say that pineapple is also. But then you have so many other fruits around you that you don't need to feel कि ये नहीं मिला तो कोई नहीं है. You have right now summer season has so many citrus fruits. We have grapes, everything. Plus you have to take lot of vegetables also. Ruffet चाहिए आपको salad चाहिए, different तरह के salad चाहिए. It's not only कि आप ये सोचो कि अभी मैंने protein बोला तो बस protein ही protein है. Because this is what I'm saying, because pregnancy is a relaxing state. If you're just going to continue taking proteins without taking vegetables, आपको constipation हो जाएगा. और constipation is also one problem which usually pregnant females have. So उसको counter करने के लिए you need to add some vegetables in your fruit. तो that's the reason I told you can have salads जिसमें आपने proteins डाल रखे हैं और जिसमें different proteins में जैसे sprouts हो गया आपके, you can have paneer chunks also. So you get a balanced thing with you. Then obviously you can have moong dal chila also, so you have protein but in that kind of base जिसमें आप vegetables डाल दो. So this will help. And if you're a non-vegetarian, then आप omelets खा सकते हो with lots of vegetables in it. So you have to improvise. Intelligent patient is who improvise what the things are given to her and what she can get the hold of. Because you have to understand, it is not like कि कोई carbohydrate, जैसे अभी मैंने आपको बोला कि घी नहीं खाना. Similarly, protein नहीं खाना, but protein should be a major part of your meal. That you have to remember. Can we have hot things in early stages of pregnancy? So what exactly are hot things? First we need to clarify that also, because hot things may, if we are talking about tea, coffee, then obviously in moderate quantities are okay. And if we're talking about dry fruits, which usually people feel कि वो गर्म होते हैं, so अगर वो गरम का वाला फंडा है तो the point is this कि you can have almonds obviously, but रात को आप उनको soak it at night and 7-8 सुबह morning में खाइए, and it's very good because वो बहुत bland है. Usually people have morning sickness. वो मॉर्निंग सिकनेस के लिए बहुत अच्छा है बिकॉज यू गेट अप, यू डोंट नीड टू गेट अप एकदम उठ के बिल्कुल बेड से निकलना नहीं है, वहीं पे अपने बेड के साथ बैठे बैठे पे गेट योर आमंड्स एंड उसको आराम आराम से खुद ही छीलो और खुद ही खाओ. Because you will take some time and you will nibble also and you will enjoy. That should be the first thing you can have. Obviously you can have a coconut water also along with it if you feel कि कुछ ज़्यादा dry हो रहा है, rather than going into something like tea. एकदम पहले ही एसिड लेवल इतना ज्यादा है and you end up having tea even with a biscuit also, you will definitely have a morning sickness वाली feel, or you might have a gastritis or a nausea, or you might puke also. So these are things which you need to see. And obviously walnuts are also good. 1 or 2 walnut will not harm you. Initial pregnancy precautions. So initial or throughout pregnancy, there are few precautions that are just like a golden rule. First is plenty of fluids. You need to take plenty of fluids. And second is हर 2 घंटे में कुछ ना कुछ खाना है. So rather than having a 3 meal diet, just break it into 6 parts. आप आराम से उसको 2 घंटे में कुछ ना कुछ खाओ. So it's not small and frequent meals is the golden rule of throughout pregnancy. Why? शुरू के initial pregnancy में जो आपको शुरू के 3-4 months में your gastritis and nausea is not going to eat you much. So अगर आप नहीं खाएंगी तो भी acidity बनेगी because your stomach is empty, and if you land up eating more then also you will have gastritis because your food is not going to get digested quickly. So अगर आप उसको रखेंगे later on, जैसे जैसे pregnancy advance होती है, the stomach capacity is obviously reduced क्योंकि वो जो abdomen में जगह है वो आपका uterus ले रहा है. तो uterus जैसे जैसे grow करेगा, stomach के पास तो जगह ही नहीं है. तो फिर क्या होता है कि usually patients which are following their non-pregnant routine, 9-10 बजे खाना रात को, they usually complain हमको रात को नींद नहीं आ रही, हम लेटते हैं तो हमें लगता है हमें सांस नहीं आ रहा, because your stomach is not getting digested. वो stomach जाएगा कहाँ? It will go back to your lungs. तो आप you will not be able to breathe. So have to understand 7-8 बजे खाना खाओ, walk करो, 10 बजे have a glass of milk. It depends on your choice. You can have a cold milk also, you can have a hot milk also, whatever suits you. उसको लो और सो जाओ. That's the best way to deal with it. These are, I'm talking about diets, so I only mentioned the initial pregnancy precautions ये वाले, but obviously there is a long list, like you should not stand for a longer time, बहुत ज़्यादा stairs ऊपर नीचे नहीं करना है, you have to walk carefully, you don't need to wear heels जो ऐसे वाला हो because obviously there is a chance of you being toppling off, so ये थोड़ा ध्यान आपको रखना है. But I think that's another topic to cover. It's summer and humid right now. Can a pregnant patients can avoid walk? Why to avoid a walk? I would say कि आप अपने साथ में carry a bottle with you and walk around, because walking is a very good exercise. It's the point is this कि if we want a healthy pregnancy, then healthy pregnancy consists of a diet and exercise. So walking is the best exercise which a pregnant female can have. I am not asking her कि आप 1-1 घंटा walk करो, but 25 to 30 minutes is not going to hurt you much. तो आप उतना भी एक routine बना लेंगे, that will also help. So what are other exercises which pregnant patients can do? So that is one thing I really wanted to address today, because I feel that's very controversial. You will find people saying कि अरे ये exercise नहीं कर सकते, वो exercise नहीं कर सकते. So if you know swimming is the best exercise. It's a low impact exercise you can do. As I already mentioned, walking is a very good exercise. You can do some strength trainings also. Even mild aerobic exercise will not hurt you if there are no complications, as mentioned by your gynecologist. So that really helps. Even squats help. So I would say अगर आप ठीक हैं तो 6-7 months के बाद में you can start doing some squats also, because it is going to actually आपके pelvic muscles को भी strengthen करेगा, आपके hip joints, आपके joints खोलेगा. It will help you in your normal labor. So these are few exercises which are good, and obviously breathing exercise is the best exercise. It's very important because a pregnancy is a stressful condition, not only physically, mentally also. So if it's possible, you can do some breathing exercises or some form of meditation. It's going to take you ग्रेट वे अहेड, बिकॉज ये जो एंग्जाइटी और एप्रीहेंशन जो होती है, विच आई यूजुअली फाइंड विद पेशेंट्स, बोले रात को नींद नहीं आती, ऐसे ऐसे सपने आते हैं, समझ नहीं आता कि क्या करें, बिकॉज योर माइंड इज नाउ स्टार्टिंग टू प्ले, कैसे होगा, क्या होगा, सिजेरियन होगा, नॉर्मल डिलीवरी होगा, इसमें इतनी पेन होती है, इसको कैसे करेंगे. सो stop dealing with all that questions. You will get your time and we will deal with them as the time comes. अभी आपको जो करना है वो बहुत इंपॉर्टेंट है, बिकॉज 5th मंथ प्रेग्नेंट पेशेंट को मैं नहीं बता सकती कि आपकी नॉर्मल डिलीवरी होगी, सिजेरियन होगी, बट आई कैन अश्योर हर कि आप, इफ यू फॉलो अ हेल्दी डाइट और अ हेल्दी लाइफस्टाइल, you will have a healthy baby, which should be the topmost priority, rather than a normal delivery which got complicated, और a cesarean जिसके अंदर बेबी को बाद में had to मतलब we had to keep in nursery, it was critical. It doesn't pay off. So you have to understand, it's not only कि उस टाइम पे डॉक्टर क्या कर रहा है या डिसाइड हो रहा है, it is you who is going to take the responsibility. If you are following a good diet, if you are doing your exercise regularly, I've seen patients जो normal delivery में 4-5 घंटे में आकर डिलीवर हो जाते हैं, and there are other patients also जो 2-2 दिन तक नहीं होते. If you have been a sedentary lifestyle, आपको बोलते हैं हम एक्सरसाइज करो और आप बोलते हो मुझसे तो ये एक्सरसाइज नहीं हो रही है, मेरे को तो बहुत थकान हो रही है, और मैं अब आपके लिए एक्सरसाइज कोई नहीं करेगा, आप ही करेंगे, और हिम्मत भी खुद ही करनी पड़ेगी. So why breathlessness takes place suddenly? What's the reason behind? As I was discussing earlier, breathlessness is because जैसे ही आपकी बॉडी की रिक्वायरमेंट्स और बढ़ रही है, आपका ब्लड सप्लाई और बढ़ रहा है, सो जब आपको इतना सारा ब्लड वॉल्यूम इंक्रीज हो रहा है, सो देयर आर चांसेस योर हीमोग्लोबिन माइट फॉल. सो यू हैव टू कीप योर हीमोग्लोबिन आल्सो इन चेक, बिकॉज ब्रेथलेसनेस का रीजन सिर्फ ये नहीं हो सकता कि सिर्फ लंग को ऑक्सीजन रिक्वायरमेंट की वजह से हो रहा है. So you have to find out the reason. What is the reason of breathlessness? You have to go to your doctor and get it checked. Is it normal? And she might tell you few breathing exercises also that you can follow. And as I've already told you कि रात को ज़्यादातर breathlessness का reason क्या होता है, because if you had a late night meal, तो वो आपका digest नहीं हुआ, तो वो आपको तंग कर रहा है. But there are other reasons also. अगर आपको दिन में हो रहा है, यूजुअली आई हैव सीन कि जब भी ब्रेथलेसनेस होता है ना, हमारा नॉर्मल रिफ्लेक्स क्या है, वी स्टार्ट ब्रीदिंग फास्ट. दैट्स द रॉन्ग वे इन प्रेगनेंसी. वो और ऑक्सीजन डिप्राइवेशन कर देगा एंड आपको और लगेगा मुझे सांस नहीं आ रहा. सो व्हाट यू नीड टू डू इज टेक अ डीप ब्रेथ एंड लंबी लंबी सांसें लेनी. यू हैव टू टेक अ डीप ब्रेथ्स, नॉट फास्ट ब्रेथ्स, नॉट फास्ट एंड शैलो ब्रेथ्स. इट हैज टू बी डीप एंड लॉन्ग ब्रेथ्स एंड योर ऑक्सीजन विल बी बेटर. So, but there can be other reasons also. So you need to consult your doctor for that. So which juice is healthy during pregnancy? I would say juices से बहुत अच्छा है अगर आप पूरा fruit खाओ. We come back again to the topic of roughage, because roughage is important. अगर आप roughage नहीं बना रहे हैं तो आपको constipation होगी. तो वो juice जो है ना, चाहे आप किसी का भी ले, if you are taking a पालक का जूस ऑल्सो, अगर ग्रीन्स वाला जूस भी है, देन पालक पूरे के बनवाओ उसको, पालक की सब्जी खाओ, उसको खाओ. जैसे अगर आप किसका ये ऑरेंज का जूस ले रहे हो, मौसमी का ले रहे हो, देन हैव अ मौसमी पूरा. वो आपको जूस तो जाएगा ही जाएगा आपके अंदर, प्लस यू विल गेट योर रफेज आल्सो. एंड जूस जो ये बाहर वाले होते हैं, ऑब्वियसली दे आर स्वीटेंड. व्हाई डू यू वांट टू हैव एन आर्टिफिशियल स्वीटनर? जबकि आजकल तो फ्रूट्स आर सो नाइस. यू कैन हैव अ वाटरमेलन. इतने अच्छे अच्छे फ्रूट्स हैं, वाटरमेलन, और ये जो मेलन्स हैं, दे आर रिच इन वाटर. कितना अच्छा वाटर आपके अंदर जाएगा. अपने आप को बैलेंस आउट एंड फाइंड गुड ऑल्टरनेटिव्स. एंड आई नो यू आर वेरी इंटेलिजेंट इनफ, यू विल फाइंड वेरी गुड ऑप्शंस, बिकॉज देयर आर ऑप्शंस इफ वी लुक फॉर दैट. I think I have covered enough of this topic. I know it's a topic which is never ending. We'll have lots of other queries also, but my emphasis is still on the same thing. For a healthy lifestyle, you need to have a balanced, healthy diet, which you can divide in 6 parts. हर 2-2 घंटे में कुछ ना कुछ लीजिए. Every hour में try to have some form of liquid. Just make it a priority for yourself कि आपने फ्लैट्स डालना है और थोड़े से कंफर्टेबल मोटे सोल वाले शूज डालना है. वॉक अराउंड फ्यू एरियाज में. हर जगह पे कोशिश नहीं करिए कि यू हैव टू मतलब आप अपनी गाड़ी बिल्कुल वहीं पे पार्क कर देंगे जहां आपने जाना है. थोड़ा सा दूर पार्क कर लो, सो इट विल हेल्प यू ऑल्सो. थोड़ा सा वॉक करो. इफ इट्स पॉसिबल फॉर यू टू गेट अप अर्ली इन मॉर्निंग, सुबह उठो, से गुड मॉर्निंग टू बाहर जाके देखो. जस्ट इवन फ्रॉम अ बैल्कनी ऑल्सो यू कैन हैव अ वेरी गुड व्यू. देखो and get a good oxygen, and you will feel so much positivity in you, especially in this negative times, so uncertain times. These are few things you need to remind yourself. everything will work out if we want to work out. Thank you so much.